plexus. 3 cervical ganglion, all of them has a spinal, vascular, and cardiac branch, and also you should know this branch. This branch. Ansa subclavian. Ansa subclavian originate from the middle cervical ganglion and runs the subclavian artery from the anterior, inferior, and posterior part and insert to stellate ganglion, insert to inferior cervical ganglion. Is named ansa subclavian. Okay?
Yes.
They are the branch of the cervical sympathetic ganglion. See here. Superior. What are this branch? What are this branch?
Sympathetic.
I said that we have 3 types of nerve. Spinal. Insert to the spinal
Yes, sir.
nerve.
Yes, sir. Spinal.
Okay?
Yes, sir.
Insert to the spinal nerve from C1, C2, C3, and C4. From C1 to C4 derived from superior ganglion and insert to the spinal nerve number C1 to C4.
C4.
Okay? This is middle ganglion. Middle ganglion is smaller than other. Superior ganglion is larger than other. Okay?
Yes, sir. Yes.
From middle ganglion, we have a spinal branch. Spinal branch
C4.
number C5
5.
and C6.
6.
This branch insert to
Upper limb.
from here,
C7 and C8. Inferior.
inferior.
Or
From
second.
inferior, C7 and
C8.
C8. Insert to the spinal nerve number 7 and number 8. Number 7 and number 8 insert innervate which part?
Cervicothorax.
Brachial plexus. Brachial plexus insert to
Yes, sir.
the upper limb. Okay?
Yes, sir.
They are the cervical, the
Many.
spinal branch. Okay? See this branch. What is this branch? Here.
Internal carotid.
Carotid branch. During the internal carotid artery. Also, we have in this area jugular branch. Through the internal jugular vein. See this branch. What is this branch?
Subclavian.
Subclavian or nerve. Subclavian nerve from
Inferior.
inferior
ganglion.
or from stellate ganglion. Okay?
Satellite.
And also this branch
Still.
here, cardiac branch. Insert to the cardiac plexus. Okay? You should know the Horner syndrome and the sign of Horner syndrome. This Horner syndrome is created because of any injury to the sympathetic ganglion or sympathetic nerve. And what is the sign? Petosis. Petosis, because the superior palpebral muscle here, superior palpebral muscle, which elevate the superior palpebra, okay, is innervated partially by the sympathetic fiber. If during the injury of the sympathetic fiber, you have, this is named petosis. This is named petosis. Okay, depression of the upper lid
Eyelid.
here. So one sign of the Horner syndrome is the petosis, and it is because of loss of the innervation of the superior levator palpebral levatories. Okay. Another sign is anhydrosis. Anhydrosis, as you know, during any stress, for example, for the final exam, you see that your palm is wet. Yes?
Yes.
Why? Your auxiliary is wet. Because the
Sympathetic.
sympathetic nerve innervate
Starting.
the secretory gland. The secretory gland. Okay? The gland, the sweet gland in the palm, the sweet gland in the auxiliary area. So
Yes, sir. It's more active.
the skin of the face also has some gland. Yes, have some sweet gland. This gland are innervated by the sympathetic fiber. And if we cut this sympathetic fiber, this area is dry. Okay, this area is dry because the loss of the innervation of sweet gland is named anhydrosis. Anhydrosis. It is another sign of the Horner syndrome. Meiosis. What is meiosis? What is meiosis? Meiosis and midriase. Midriasis and meiosis. The midriase is the dilation of the pupil. Dilation of the pupil is the midriase. Meiosis is just opposite the dilation, is the narrowing of the pupil. Okay? Narrowing of the pupil is the meiosis. So, what is the function of the sympathetic fiber in the pupil, in the eye pupil?
Dilates in sympathetic.
Yes,
it dilates.
dilation. Okay? So, when we don't have the sympathetic fiber, we don't have the dilation. The sign is named
Meiosis.
meiosis. And another sign of the Horner syndrome is the enophthalmos. What is enophthalmos? When your eye and your fatty tissue during the eye in the orbital cavity is located in the depths of the orbit is named enophthalmos. The opposite of enophthalmos is exophthalmos. The exophthalmos, maybe you see some patient that their eyes is located, is seen outer to the orbit. Yes, it is exophthalmos. A sign of the Horner syndrome is enophthalmos. Why? Because the fatty tissue in the orbit is also innervated by the sympathetic fiber. When we don't have the sympathetic fiber, okay, we see the loss of the fatty tissue. When we have the loss of fatty tissue, your eyes is located in the depths of your orbit and is named enophthalmos. These are 4 signs of the Horner syndrome because of the injury to the sympathetic fiber. After sympathetic trunk, we arrive to the muscle, perivertebral muscle. Okay? Perivertebral muscle are the deeper area of the SCN area.